I would be remiss not to say that I love my technicians. They're fantastic. The day does not run without them. And I would say at many places it probably could be said that what they can do is underused. Speaking from an imaging perspective, I would put out a plug. There's recently been approved the specialty for technicians in diagnostic imaging. One of our technicians at NC State has been a part of getting that formed. And I think that's going to be a really nice way for folks to have some more standardization of the skill set that those technicians can have that particularly want to work in diagnostic imaging, whether it's radiographs or CT or MR. I think they can play a really important role, and especially in a general practice, if you say had a technician who is specialized or had their specialization in diagnostic imaging, you could be much more trusting that you could set them off to get those radiographs for you and come back knowing you're going to have diagnostic quality images, and maybe they got those other views you needed because they thought ahead of that, because they have seen those variations and know what else might be useful as an additional view. And make it much less veterinarian-centric to really get the study optimized before we even get to the diagnostic stage. So it's really invaluable. They're monitoring the patients while they're on the table. They're frequently letting me know if they have concerns about that patient, if we need to stop the exam and do something else. So, the list is really endless, but those would be a few that come to mind.
Meow.